Hello, ladies, gentlemen. Thank you very much for joining me in this talk on what I think is a very interesting subject: why your medical doctor often cannot diagnose your health issues. So, of course, we all can respect the medical doctors. This is nothing against medical doctors or the profession of medical care. It's only here, this talk is only to talk about the limitations and helping you understand the limitations of a medical doctor. And this is mostly based on their training. Of course, conventional medicine relies almost entirely on lab work and imaging these days. And partially this is due for legal reasons. They cannot deviate. They need to see certain numbers on your lab results before they're able to prescribe a medication. However, there are a lot of other forms of diagnosis, which of course take much longer to learn than just looking at numbers. And Chinese practitioners, Ayurvedic doctors, all use other very effective forms of diagnosis, including observing the skin, the eyes, the tongue, feeling the pulse, and of course, questioning skills in Ayurveda is considered uh, uh, one third of the skill of diagnosing. Observing, which is very important. We talk about wrinkles, tongue, eyes, and then touching, where you feel the pulse. Maybe you feel different organs, and then third is questioning. And to come to a conclusion, usually two or three, or preferably all three of these methods should concur. So maybe you observe something on the tongue about, say, the liver, and then you press or palate the liver, and you feel the client responds with tenderness, or you feel swelling. So that's your second confirmation. And then you could ask them questions about their digestion of fat, or sensations of nausea when they have fried food. And when if they said yes, then you've used three forms of diagnosis: observing, touching, and questioning to confirm. So it's not good even for somebody who's trained to rely only on one of these types. That's why we want to verify our conclusions. Only questioning is often insufficient because you're reliant on the client, and observing is very, very effective, and usually the first form. And then the second is touching, which includes in Ayurveda feeling the pulse. And of course, in Ayurvedic and Chinese medicine, feeling the pulse doesn't mean just feeling the pulse rate, but it's feeling, the organs in the system, in the body, through the pulse, the different conditions of the different organs. It just takes years to learn, but it's really quite amazing once you learn it, how much information can be gathered from the pulse. And myself, when I traveled extensively, particularly I was in like Morocco or France, where I would be presented with patients who didn't speak English, mostly French, but sometimes there were people who only spoke their indigenous language. And either I didn't have a translator for some reason, or my translator didn't even speak the language. And then some of these people never completed any paperwork, nothing. And then the translator wasn't able to translate or didn't show up. And I was forced with relying almost completely on observation and touch and pulse. So, in those type of situations, it really does strengthen your skill level for diagnostics when when you can't communicate with the person and they didn't provide any paperwork in advance. So let's say limited communication. But it can be very accurate. And in fact, most Ayurvedic doctors don't require you to fill out any paperwork at all. They just observe you as you're coming in the door. I can remember my teacher telling me who had diabetes before they got from the entrance to his office to the chair. He would turn to me, this person already is a diabetic. I would guess the numbers are close to 200. He could say that before the person sat down. Now, of course, in hindsight, we now know what he was looking at. He was looking at those kind of like darkish lines around the creases around the neck, and sometime at other creases in the body. And then another time, he shook hands with a man, and then he smelt his hand, and he guessed the blood sugar was very high, and that was because he could feel the kind of the from the sweat in the hand, and then smell the sweetness. So these were the skills that a good Ayurvedic doctor has, and that was before he began to feel the pulse, which was, most Ayurvedic doctors, they rely largely on the pulse. So first is the observation, and then the pulse, where they can they detect even kidney failure. I remember my doctor, teacher in India, was treating a lot of kidney failure cases, and that's, of course, who I learned from in reversing advanced kidney failure cases, even those who were starting dialysis. And if this took me years of going back and forth to India, but he could tell from feeling the pulse if the kidney, what the condition of the kidneys were. And often they had the lab work there, and he could feel the pulse. While they were still looking through their papers to pull the lab work out, he already says, "Oh, your kidneys are failing, and the flow rate is very poor." And sometimes he would even guess that creatinine was high, and they hadn't even presented him with the papers yet. And by the time the papers came on the table, we're talking just 1 or 2 minutes since the person has sat down, he had already determined that they had kidney failure. This just shows you the the level of diagnostics. And then, of course, people do show you the lab work, which is helpful. Often it just confirmed what he already knew. And then he could also then question, okay, how many times you urinating at night? And he could ask more questions. So he was combining the visual when the people came in the door, and looking even at the wrinkles on the face, the tongue. There's so much we can learn from the tongue, the eyes. Of course, iridology is a whole science in itself, but just so many ways we can observe uh, their health condition of a person just by observing. Then, of course, he would feel the pulse and maybe press on different organs, and then he would ask a few questions. And he was quite efficient at this, and he could do this in less than 5 or 10 minutes. And often the people didn't even have lab work because they're rural people, and he'd be able to diagnose all their health conditions without the lab work. Now, of course, it was helpful for him to get the lab work. Say you're treating kidney failure, so he could then monitor the numbers. So the lab work is still very valuable, and I do the same thing when I identify uh, uh, issues, even just like high blood sugar, but the person doesn't give me the numbers. Well, I said, you really need to be measuring it on a regular basis. So when we do our follow up, we can see the improvement. So the lab work is still valuable. And as you know, if you're my patient, I ask you a lot of questions, 10 pages of questions, but I off in my form, which is really a form of questioning, but instead of questioning you at the time of the appointment, I'm just having you fill out a big form, and those are all my questions. And these are based on the Ayurvedic perspective. And that helps me. And then, of course, on Zoom, I'm still able to observe you and look at your fingernails, your skin, your eyes, your tongue, etc. So, but I can't touch on Zoom. So I'm relying more on my observation skills and my questioning skills to come to and lab work as another means. So it's this using multiple means to diagnose a person and their health issues, and not relying only on lab work, and then, of course, imaging. And there's some of these tests can be quite evasive, and even excessive CT scans have been said to contribute to cancer. And some things you can't really even know unless you question a person, like what's their diet, what are they eating, how's their appetite, how are they sleeping. So, unfortunately, many medical doctors are very limited by the system that they're in. I think medical doctors in general have good intentions, but they're in a system in the United States, at least, that limits them and of what they can say, what they can't say, and even how much time they have. So I spend a good most of my time in a new patient is spent diagnosing. If I do an hour and a half appointment, uh, 45 minutes, sometimes even a whole hour is spent just doing the diagnosing. Because once the diagnosing is accurate, then the treatment is easy. And this is really the most important part of any practitioner, natural practitioner, is your diagnostic skills. And unfortunately, I see that a lot of people have studied Ayurveda or naturopathic healthcare, and they haven't really put in the time or the years in improving their diagnostic skills through observation and touch and questioning and or even learning to read lab work for that matter. And they jump too quickly. Oh, take this for your blood pressure. Take this for your digestion. But they haven't done a complete diagnosis, and this will always lead to uh, misdiagnosis and poor outcomes. And we see this a lot with untrained practitioners in the United States, where they don't have the diagnostic skills and they jump to conclusions that they've just maybe learned online. Like if you go online and say, what do I take for my blood pressure? What do I take for my blood sugar? That's very, for lack of a better word, dangerous, or because there's no diagnosis. And unfortunately, this is the way that a lot of um, healthcare practitioners function, is there's no diagnosis at all. They just think, okay, you got high blood pressure, take hibiscus tea and hawthorn berry. They'd give everybody the same thing, but you're not really getting to the root causes. And of course, the first line of treatment is always remove the cause. So cause has to be diagnosed. No matter what condition a person has, whether it's, they could have high blood sugar, high blood pressure, and cancer and kidney failure. I have to know the cause of everything. And the cause is I have to diagnose the existing condition, but a lot of people, they know their existing condition because they're bringing me the lab work. So that kind of eliminates that. But the second aspect of diagnosing is understanding the cause. And that may take questioning of the person's lifestyle, their habits, how they're sleeping, how much alcohol they're drinking, even past use of drugs or past medications or treatments that they've had. All of this will help me to diagnose why the person has the health condition they have. Of course, with blood sugar, it's usually quite, the same. You'd be amazed if you saw me do my job every single day, how much repeating I do and how similar cases can be. Like I have a lot of Indian patients, and basically they get high blood sugar from having sugar in their chai. And then we get people who have high blood sugar from having soda pop. And then we get people with high blood sugar from drinking sugar with coffee with sugar. So, and then there's always some sweets and cookies in there as well. So the people are very much repeating the same pattern, particularly for blood sugar. Now, of course, in Ayurveda, there's 22 types of diabetes. In the West, we could say that there's just maybe 4, type 1, where it's failed at birth, which actually came from the cause was the mother having the sweets or the high blood sugar during pregnancy, resulting in a non-functioning pancreas for the child. And then there's, the pre-diabetic, diabetic, and insulin dependent. So we could say there's 4 types of diabetes in Western medicine, but in Ayurveda, there's 22 types. So we have to know which of those 22 types, and that takes a diagnosis, which most people don't really even understand is taking place when I'm asking them so many questions, because in their mind, they just think, hey, I have high blood sugar. You treated my uncle. Just give me the same thing. But that's not how it works in Ayurveda. It's much more sophisticated. In fact, I've had couples, many times I have couples where, they both have high blood pressure, but the cause is completely different. The husband could have blockage in his arteries from having too much fried food, hamburgers, and the wife could have high blood pressure from her anxiety and nervousness, for example. So the herbs are completely different, but it's only through proper diagnosis of the cause of the condition can I treat it. So there's really nothing more important than diagnosis. Once the diagnosis is accurate, then the treatment, I could use Western herbs, I could use Indian herbs, I could use home remedies, I can change the diet. I can have multiple types of treatment once I know what I'm treating. Um, and if I do make a mistake where the results are not what I expected, usually on the second appointment, it's usually due to I'm going to have to re-diagnose the cause and re-diagnose the type of high blood pressure, re-diagnose the type of high blood. So I usually will re-diagnose, pick a different cause, a different type of high blood pressure, and then change the herbal remedies. Sometimes people think, hey, that's it, I'm done, I didn't get it right. And that's not for the case because there's herbalism is very vast and Ayurveda is very sophisticated. But if any mistakes are made, it's usually with poor diagnosis. So you can see how important it is because your body is giving out signs all the time. And unfortunately, if you're not trained in these things, the doctor will ignore it. And there's, many things that can cause a lot of health issues, just constipation, poor diet, poor sleep. So all these need to be analyzed. And then all this information needs to be compiled in your brain. And then you'll be able to communicate it back to the patient. This is why you had the health issue. And then you're able to classify this health issue based on the type or cause. So let's not blame the medical world. Let's just accept the fact that a medical doctor is trained in medicine, not in diet, not in nutrition, and definitely not in herbs. In fact, we should really probably take with a grain of salt every time we do see a medical doctor speaking about herbs or home remedies because he's not really been trained on it. He's probably just studied it online like you have, not gone through years of training and books. And he's not following a system. You see these people online talking about 10 foods that will lower your blood pressure, 10 foods good for your kidneys. Well, these are all fraudsters. They're just going online and searching for this information, and they're just compiling it and presenting it back to you. I mean, most of the YouTube that we're seeing online is in this format where people are just searching online and representing it back. And they're mostly talking about nutrition. See, so the West is only at the level of understanding nutrition. They haven't even got really to the herbs. I mean, they're doing a little turmeric, couple mushrooms, and a few herbs they're starting to talk about, but nobody is trained. I mean, you have to study a system like Chinese medicine or herbal medicine. It takes at least 10 years just to study the herbs and the diagnostic method. So, this is the problem with following advice online is nobody's diagnosing you. They're just kind of presenting, hey, okay, you have kidney failure, do this, but they don't know, is it creatine high, is EGFR low? They don't have any information, and they're now telling you what to do. And one other point here is that, if we do look at the lab work, we can see that, or we must understand that the medical doctor is only going to talk about a condition when it's very much out of range, except for, of course, cholesterol. You could just be a little high and you're on the statin. So there's a few exceptions. But if we talk about kidney failure, for example, EGFR, the flow rate through your kidneys, you could be at 61. It's kind of not quite a percentage, but you could almost think of it as a percentage because you really should have numbers in the 90s or 100. So if you're down to 61, you can say there's 30% of your kidney function is gone. But they're not going to say anything because you're still within range. Anything over 60, in most cases, they consider fine. But I would not consider that fine. It means you're definitely on the path to kidney failure, particularly if I can see your past lab work and see that, okay, 1 year ago you were in your 70s, and 2 years ago you were in your 80s. So you can see it's deteriorating. So it's only a matter of another 6 months, and you're going to be diagnosed with stage one kidney failure. And in the meantime, the doctor will not say anything because you're not in within range. Now, of course, they have no treatment for kidney failure, so I guess there's no point to really talk about it, just dialysis and kidney transplant. But the point is that, your lab work alone is not conclusive to show all of your health problems. And this is the more major reason why medical doctors really can't diagnose your health issues. So to summarize, lab work is just a limited form of diagnosis. And many people have come to me. I mean, a lot of people have said, hey, all my lab work is fine, but I'm not fine. I'm tired. I'm bloated. I can't hardly eat foods. I can't sleep. I'm constipated. I have anxiety. But if you look at the lab work, everything is within range. So we know it's not accurate or incomplete. I mean, there's some information in there, but this is not complete. And then the second is the medical doctors who don't have time to ask about your lifestyle and your diet. And three, they're not trained in observing or touching. They're just trained in doing more, lab tests and more imaging and more kind of what I would call evasive tests like colonoscopy. And so a lot of times I'll have patients with, say, ulcerative colitis or even just irritable bowel. And to me, it's very obvious you have irritable bowel. I mean, every time you eat food, you're getting diarrhea and you have pain in the descending colon. And they go, well, the doctor wants me to do a colonoscopy. Well, that's only because he doesn't have enough common sense to diagnose you have irritable bowel, or he wants just a photo of your inflamed colon. But there's really no point to do a colonoscopy when it's obvious that you have an inflamed colon. It's undisputable. But this is the path the medical world will take, is still go down this path of doing more tests. I mean, okay, they could be looking for polyps or tumors or something else, but it doesn't matter. You still have to treat the inflammation in the colon. And at that point, doing more evasive tests like a colonoscopy could actually make the condition worse. So, this is the problem with the doctors, the medical world. They're just so limited. All they have is medication and surgery. So you're so limited there. They don't have home remedy, diet, nutrition. They don't have any herbal system, nothing. They just only have pills and surgery. So you're really kind of limited. And they're not trained on any form of diagnosis at all, except, looking at the lab work and imaging and doing more tests. So you just have to understand the limitations. Now, I'll repeat, nothing against medical doctors. I mean, there's many patients that come to me and their blood pressure numbers are over 200 or their blood sugar is over 300. And I tell them, just go to the medical doctor, and get on the medication. Your condition is too advanced. If you would have seen me a year ago when the numbers were just progressing, we could have nip this in the bud, but most people don't do that. They wait for it to become worse. So I've referred people all the time. You need to go to the medical doctor. You need to get on the medication. Then we can start these natural treatments to improve your cardiovascular system or your insulin resistance. And then slowly, slowly, you can get off of the medication as the system or organ improves its function. So we need medical doctors. They're life-saving, but you have to understand their limitations, particularly when it comes to diagnosing and treating. Well, I hope this was an eye-opener for you, and I hope this helped you understand the value of an Ayurvedic doctor like myself and our diagnostic skills, and I hope you understand the value and limitations of your medical doctor. Thank you very much, ladies and gentlemen.